Good morning, Dr. Sergienko.
Good morning. How are you?
I'm doing pretty good. It's a beautiful morning. We're going to get some weather this afternoon, I guess.
Oh, the weather's moving in this afternoon. Well, I think it's actually this evening, but yeah, looking like a stormy weekend, a great weekend to stay at home, basically. But
yes, we're going to get a river of rain.
Very much needed.
Yes. Can you give us a quick update on where we're at with the COVID pandemic?
Sure. I want to put it in the context of not just COVID, but other respiratory diseases that we're seeing in Mariposa, in the state, in the country right now. Is we had initially started talking about RSV, or respiratory syncytial virus, in September, and in September, realistically, our COVID numbers were as low as they have been since the beginning of the pandemic. But we saw that we were seeing a spike in people who were ill with cough and fever, and when we tested them, they tested positive for RSV, or respiratory syncytial virus. And that number had continued to increase through the fall up until the last couple of weeks, and we're starting to see that now decline. But up until last week, that was really causing a number of patients to be admitted to the hospital. And RSV impacts more kids than adults. But we were actually seeing adults being hospitalized with RSV, and even some deaths in people older than 65. So we saw that RSV peak, and then a little bit later, then we saw influenza start to pick up. And unfortunately, we're seeing influenza continue to climb and resulting in hospitalizations for influenza and pneumonia. So we're seeing those numbers continue to climb. We're actually seeing more activity with influenza than we've seen since our last significant flu season, which was 2017-2018. And then that brings us to COVID. And COVID, again, we've been at our lowest level since October of 2020. But we're starting to see that picking up. We had been, by the CDC's community level, in the lowest level for the longest time. But with last week and into this week, we're staying in the medium category. And the medium category indicates that we're seeing an increased level of transmission, but also an increased level in hospitalizations. And those hospitalizations are not necessarily here in Mariposa, but in adjacent counties. And so we mentioned to the board on Tuesday at the board meeting that we made that move. And the changes we really see with that are the actions that we ask people to take is be a little bit more conscious about disease transmission. And so if you are at higher risk of being hospitalized or dying from COVID, that you consider putting that mask back on. And wearing that mask not only as source transmission, but as protection. So what we ask is either a high grade of mask or a respirator, like an N95 or KN95 respirator. And so that, again, limits transmission. And if you're eligible for a booster, or if you've not started your initial vaccine series, go ahead and get those done, and this is the right time to do that. And also recognizing that influenza is a vaccine preventable disease, that you get your influenza shot for this year if you've not done that as yet. And then as we move into the Christmas season, as we've seen throughout the earlier parts of the pandemic, is that when we see an increase in population mobility, we will see an increase in cases. So if you do any travel over the Christmas and New Year's period, please, again, wear a mask while you travel. Consider getting tested before and after, regardless of whether you have symptoms or not. Take advantage of the free testing that we have through the end of this year and maybe into early next year. We know that the availability will change with the governor lifting the state of emergency associated with the pandemic. That's happening at the end of February. So again, over the Christmas period, New Year's period, take advantage of our LHI testing site, or take advantage of other testing opportunities that are out there. And then again, be mindful, sort of the bottom line, be mindful of any symptoms that you may have. If you're sick, stay at home. If you're sick, consider getting tested. And so again, we're headed into a significant flu season, and that's overlapping with an increase in COVID cases. So take care of yourself, take care of your friends, family, take care of your neighbors, and do all those things that reduce transmission of disease, whether it's flu, RSV, or COVID.
And this is affecting young children.
The RSV infection really is, and actually when we look at it with COVID and flu, we're also seeing kids getting hospitalized with all of those things as well. We're actually seeing for that youngest population of 0 to 6 months, their hospitalizations for COVID right now are about the same as 65 and older. And so that's concerning in some respects. And then the other thing, though, that I would say is, again, with vaccines, we're now able to vaccine kids as young as 6 months. So, again, if someone has not taken advantage of that for their kids, consider getting vaccinated. And then the other thing I would say that I didn't mention previously is if you are eligible for treatment with Paxlovid or some other antiviral medication, consider getting treated should you become symptomatic with COVID.
Okay, thank you very much.
You're welcome. Have a safe and happy holiday season.
You too. Bye-bye.